On Thursday, the United States Embassy in Belize handed over $300,000 UNICEF Belize. The funds will be used for a COVID-19 prevention project in vulnerable communities. Because this disease places additional pressures on the already disadvantaged youth and children, this group faces increased risk as their support is cut off or reduced.
Prior to the advent of coronavirus, about 1 in 2 children in Belize was living in poverty. Compared to more affluent peers, these kids may have had less access to basic services, and services may have been of a lesser quality. We use fancy terms like food security, but what we really mean is that sometimes kids go hungry, or they have less access to proper hygiene and healthcare services. COVID-19 has only made these disparities worse. For the most vulnerable children, the impacts are compounded.
A recent survey shows that during the last 4 months of COVID-19, these vulnerable youth and children were deeply impacted by the economic rift caused by this disease.
Preliminary data from the Mix Plus survey indicate that, as a consequence of the pandemic, nearly half of surveyed households have suffered job loss or loss of livelihoods, and 60% have had a reduction of income.
Since the closure of schools over 4 months ago, 107,000 students have been out of school, and for thousands of those underprivileged students, it means that they don't have a meal to eat for most days of the week.
Thousands who normally rely on school meals for daily nutrition have had to look for other sources or go without. In one recent survey, a significant number of households have reported about being forced to skip meals or reduce their food intake. So it is easy to forget that hunger is a real and significant consequence of this pandemic.
UNICEF says that the basic lack of hygiene products isn't limited to homes. Hand washing stations are needed in schools across the country.
Hand washing with soap and water is one of the most important interventions to stem the spread of COVID-19, but in Belize, previously to the outbreak, 1 in 3 schools didn't have or have had limited hygiene services.
So to reduce the risk of exposure to COVID-19 among these vulnerable groups, the U.S. Embassy is supporting UNICEF's plan to distribute hygiene kits and implement a COVID-19 awareness plan across multiple vulnerable communities. Thousands, primarily children and youth, are set to benefit through this $600,000 funded project.
We'll train a cadre of young people in 9 urban areas to use traditional and social media to spread accurate information about the dangers of COVID-19 and ways to prevent its spread. And our project will support data collection analysis that will track the spread and impact of COVID-19 in Belize.
We will, among others, reach at least 25,000 parents, teachers, and children with health and hygiene education messages to help keep them safe from the virus. This includes the promotion of breastfeeding and adequate infant and young child feeding practices. We will deliver 1,200 critical hygiene packages to reach 50,000 students and support 2,400 classrooms to promote hand washing with soap and keep classrooms clean and sanitized in support of the reopening of schools.
Reporting for News 5, I'm Andrea Polanco.